I firmly believe that greater involvement of people living with HIV in matters of policy making and program delivery will strengthen the response. So governments, civil society, and donors should support them. Now, with some exceptions, government engagement with civil society is, in general, poor, especially in decision-making process, such as on national AIDS committees. If governments and donors increased core and activity funding for civil society organizations, it would enable the COSs to be more involved in national planning and the delivery and monitoring of the services. Now, without the involvement of the churches in the Pacific, the response to HIV across the Pacific would not have been as strong as it is today, especially in remote areas with limited government services. In Papua New Guinea and in Fiji and in other islands in the Pacific, the churches are making significant contributions in treatment and care. However, church responses have not always been inclusive of all community members or positive people in challenging HIV-related stigma and discrimination. Governments in the Pacific support the greater involvement of people living with HIV, with support from the donors to improve policy making and program delivery. Workplaces play a strong role in establishing policies and protecting the rights of workers living with HIV and their families. Workplace programs are particularly important for sectors with mobile populations, including seafarers, truck drivers, miners, and agricultural workers, and the uniformed services. The media have, for the most part, limited themselves to coverage of events and reporting infection figures, though this is slowly changing. They have the potential to play a more effective role in covering human rights issues and promoting HIV prevention and awareness, and in bringing about attitude change in the region. Sporting and cultural organizations are also becoming strategic partners and have a greater potential to reach young people across the Pacific, reducing vulnerability among women. This is an issue that I hold very close to my heart because I have a daughter. It is a hard thing for a father to see that a daughter does not get the same privileges as the son. Now, this attitude to women has been around for far too long. We need a change of heart and a change of mindset when we talk about women and girls. In an environment where male domination, political leadership has been the norm throughout our history, women continue to face greater challenges. There is a greater need to secure legislative and policy changes to protect the rights of women. Laws and policies that affirm and protect the rights of women are vital to the success of the AIDS response. Governments have repeatedly declared their commitment to improve the status of women and have acknowledged the linkage with HIV. In very few areas, progress has been made. In reality, efforts have been small-scale, half-hearted, and haphazard. For the response to the epidemic to be successful, national HIV responses need to be reorientated to support women's equality inside and outside the home, to protect women and girls from violence, and to change gender norms that set men against women and that put men and women at risk. Issues such as domestic violence, equality in marriage, HIV-related discrimination, and poverty and inheritance rights come to mind. Yet strategies to enforce these laws and finance their implementation are rare. Parliaments and their members should lobby for the implementation of international agreements on gender equality and the protection of women's human rights, and for laws that uphold these. Young people, the Pacific Forum leaders, through the Secretariat of the Pacific Community, has established the Pacific Youth Council to allow a space for young people to voice their concerns. This is to address the fastest growing age group in the region, which comprises 40% of the Pacific population that is under the age of 15. Employment and services are not keeping pace with their growing numbers. Improved access to education is less likely to open opportunities for paid employment. Pacific youth are at the forefront of rapid social change, including changes in sexual behavior. Cultural identity, however, is still important to young people in the Pacific, who typically have a strong sense of the importance of the family, expectations, and their own obligations and status. But social change and disruption can expose young people's vulnerability to drug and alcohol abuse, mental health problems, and suicide. All these reactions to the pressures of change are evident across the region. In some countries, recorded alcohol abuse and suicide rates are some of the highest in the world. In all Pacific countries, the proportion of HIV cases among youth has been increasing steadily, particularly in young women. More than 30 separate studies of youth defined in most Pacific surveys as males and females aged between 15 and 24 years have been conducted throughout the Pacific. Yet little information can be gleaned about the risk behaviors of young people, especially from Fiji and French Polynesia, two of the higher HIV incidence countries. Young women are affected by changing social attitudes and sexual practices, which have generally increased the extent of premarital and extramarital sex, even while reproductive health services remain largely restricted to married women, especially in more conservative rural communities. But young women often fear that carrying or asking for condoms will brand them as promiscuous. To this I say, it is the wise and thinking young woman who asks for and uses a condom. It is not a matter of being promiscuous, rather it is a matter of safe sex and security. Financing. Everything that I've already talked about requires finance. The major sources of funds to the Pacific to address HIV and other STIs are coming to an end in 2 years' time, after an initial exponential increase of funds since 2009. At present, the major funding source is through the Global Fund to fight AIDS, TB, and malaria. Another is the Response Fund, supported through Australia and New Zealand. I stand to be corrected, but as far as I know, both these major sources will end in 2013. And that beyond 2013, there is no identified funding source yet. New funding proposals and strategies will have to be developed and implemented. The Pacific Islands HIV and STI Response Fund 2009 to 2013 is a multi-donor pool funding mechanism that supports the implementation of national and regional HIV strategic plans. As of December 2009, the Australian government has contributed Australian dollars 28 million and the New Zealand government New Zealand dollars 7.5 million. In reality, they do much more than that, because their ready humanitarian assistance has greatly helped in the response of many Pacific Island countries. For your information, there are also funding that are sourced through the other multilateral agencies, such as the UN agencies and other regional organizations. Ladies and gentlemen, as part of the conclusion, I have a few open-ended questions for all political leaders in the Asia-Pacific region and beyond, as well as you who are here today to ponder upon. 1. Have we as political leaders really made an impact? 2. Have we made any real difference? 3. Are we taking far too much time to double our efforts? 4. Are we unsure as to what to do next? 5. Are we waiting for someone to cue us in? 6. Do we hope that someone else will take on the responsibility and perhaps let us off the hook? 7. Are we too cautious? 8. Are we serious when we say that our young people are our future leaders? Ladies and gentlemen, the Pacific leaders can be complimented for acting early to support efforts to maintain low levels of infections across the region. Even Papua New Guinea, while still facing significant challenges, has not, despite earlier predictions, experienced the scale and intensity of the hyper-epidemics of some of the sub-Saharan African countries. It is essential for leaders across the region to be more actively engaged if they are to translate regional political commitments into more effective national action through enhancing public policy, strengthening the enabling environment, and programming health and social services. Ladies and gentlemen, I thank you for your time.